Um, I hope the stream is live. I can see there's some issue with the network. Let me just ensure that well. I hope you can hear me pretty decently. I'll have to run a speed test. Okay, it's fine to me now. Let's start with the class. If there's anything in between that you want to point out, if you can not see anything, if you can't hear me or something, please do let me know. And a hi if you can hear me. I'm not sure if you can hear me. Let's start with class. So today's class is an upper limb MCQ marathon, right? And what do I mean by an upper limb MCQ marathon? It means that we are going to have more questions that you can imagine attempting in a single go, right? So today our plan is to do the 75 questions that are left so far. I told you that we had a total of 150 questions. Yesterday we reached till 75. So today we are going to be doing question number 76 onwards, right? Before that, welcome to Let's Crack NEET PG, the YouTube channel of Unacademy, India's largest online learning platform, their NEET PG division. And here you have the top educators, quality content, and a great learning experience, which is something that I assure you. Now, before I move on with today's class, I have to tell you who I am. So, my name is Chetanya Mittal. I am a third semester MBBS student at All India Institute of Medical Sciences, New Delhi, India's best medical college. My All India rank was 4 in the AIMS examination, UG, and my All India rank was 5 in the JIPMER UG examination. Now all the examinations have been merged into a single examination called as the NEET examination, right? And for the PG entrances, all the examinations have been merged to form the next examination, which might be held from either the 2018 batch or for the 2018 batch definitely might be held for the 2017 batch, will definitely be held for the 29th, right? So let's start with upper limb MCQ session part 3. So today I'm wearing a jacket because I thought that I was feeling cold yesterday, but now I'm feeling hot. A little weird feeling. Let me just open this a little. If that is okay. Right. So first of all, I have to tell you a little bit about the Unacademy Plus subscription. There are a lot of top educators here on Unacademy, and some of them are very experienced individuals, and they all have a unique style of teaching. So all of them have made some specific courses here based on their subjects. So like you can have courses on dermatology, you'll have courses on medicine, and likewise you will have various courses for various subjects. And all of these are plus courses and they are locked, which means you need an Unacademy Plus subscription. to access these courses, right? Now there are a few special classes also here on their platform. That is, all these special classes, they are on the Unacademy learning app, right? That is where you have to go. Or if you are using a laptop, you can simply go to unacademy.com, right? Unacademy learning app, or on a desktop, you can directly go to unacademy.com, right? And you will set your goal and you will be able to access all the special classes for NEET PG. It will also show you which classes are live right now. Okay, so you will be able to access some few very important points. Like I had made a special class called arteries of upper limb. Okay, so if you want to know about the arteries of upper limb, that is a very good resource to know about all the arteries of the upper limb, right? So you can download the Unacademy learning app even if you don't plan on taking a plus subscription. Guys, I'm feeling really hot. I'll just have to kind of change to the t-shirt back. Now I feel a little better. So let's move on to the special classes. So these special classes, they are provided free of cost on the Unacademy learning app. Even the class that you're looking at, even though it's on YouTube, it is also a special class which is coming to you free of cost. And so these are basically YouTube special classes, but a lot of special classes are there on the Unacademy learning app. And for that, like I was saying, even if you're not taking a plus subscription, you should still download the app. Another reason you should download the app is that there are free mock tests there on the app. So it's a good way to get yourself some good question practice. And if you take a plus subscription, you will never fall short of questions. There are weekly mock tests that you can attempt, and these mock tests will keep you sufficiently prepped for your examinations. So why you have to learn online, why you should learn online, is the simple reason that we are MBBS students, we have busy schedules and we require flexibility. That flexibility comes only when you have such a platform where you can learn anytime, anywhere you want, right? एंड यू कैन लर्न इन द लैंग्वेज ऑफ योर चॉइस. आई कैन स्पीक इन इंग्लिश. मैं हिंदी में भी उतने अच्छे से बात कर सकता हूँ. अगर कुछ बीच में नहीं समझ आता तो बोल देना, मैं हिंदी में समझा दूंगा. ठीक है. एंड you have the option for unlimited practice because you can retake every test. You can experiment with that. Okay, and here you can be chatting. The Unacademy platform has a very good chat feature. Here also you can type whatever you want in the live chat. I have opened the live chat on my mobile phone, so I will be able to read whatever you write, and I will try to keep the class interactive by asking you questions. And about that, you can just go ahead and install the app. Now it's my job to tell you a little bit about the subscription plans. So I'll come to this later, but before that, I want to tell you about something called as the referral code. Now, what is a referral code? Referral code is kind of a coupon code, and every educator has their own. And it does not mean that if you use my referral code, you cannot watch any other course. ठीक है. मेरा referral code use करके आप सबका course देख सकते हो. My referral code allows you to watch any course that you want, right? From that particular goal. Okay, so if you write here Chetanya 10, that is my referral code. Just write Chetanya 10 and click on apply. All right, what will happen is that this cost will directly become 10% less. Okay, 90% रह जाएगा. ठीक है, so this will directly become less, and then you have the option here to add credits. Okay, so भी apply कर सकते हो, right? So what I will do is, if you use my plus referral code, so first of all you should contact me. My Telegram channel is at the rate NEET PG Chetanya, right? उसका एक discussion group है. From there you can contact me. And my Instagram handle is at the rate Chetanya.guru. You can also text me there. ठीक है? तो यहाँ text कर देना कि आपका referral code use करना है. And then I'll tell you, apart from the 10% discount, I'll tell you how to use the credits, right? Apart from that, I will give you some additional cashback from my end. I have already given it to a few people, and you can also get advantage of this fact. ठीक है? तो ये देखो यहाँ पे सीधा डिस्काउंट हुआ, apply okay, 36,000 हो गया, and then you can simply take the subscription, right? So see, this is the latest pricing structure. This is for Unacademy Plus. This is for Unacademy Iconic. Unacademy Plus, basically you get all the advantages of the Plus courses. That is, you get structured courses, you get live classes, you get quizzes, right? And you get all the benefits here of Unacademy Plus, right? So this is you can take a various plans. If you want to just give a trial, you can take the 1 month. If you are serious about it, take the 1 year. If you are serious and you are in the third year, take the 2 year plan. And if you are serious and you are in the second year, that is, you have an early advantage, take the 3 year plan. But I would recommend, instead of taking Unacademy Plus, take Unacademy Iconic, right? I'm not saying this because it is more expensive, right? I'm saying this because Unacademy Iconic has a much more useful feature, that is Unacademy Plus, and you also get the best of Prep Ladder. You get Prep Ladder. That means you get entire access to Prep Ladder, its question banks, its videos, everything, right? That is something that is pretty great because see, this is 1 year, this is 2 year, and this is 3 year. So you get Prep Ladder here. And for 3 years, if you look at this 82,800, that is after my referral code has given you a 9,200 rupees discount. So how much discount do you get with my referral code? You can get 9,200 straight away. If you have an adequate amount of credits, you can get around a rupees 1,000 discount from there. And personally, I can give you somewhere around 5,000. So that's a good discount. That's somewhere around a 15,000 discount with my referral code, and that will bring down this cost to somewhere around 75,000. Okay, and that is pretty decent given that you have to pay 25,000 per year for two platforms, that is Unacademy Plus and Prep Ladder, both. Okay, so it basically means 12.5 thousand per year for Prep Ladder for a year, right? That is pretty cheap. That is cheaper than the actual cost of Prep Ladder, right? For Unacademy Iconic, you get a very great advantage. So let's move on to question number 76. The first extensor compartment of the wrist have the following structures. The first extensor compartment of the wrist will have the following structures. Guys, let me know your answer. In the chat, let me know your answer. Okay, I'm waiting for an answer. थोड़ा busy था क्लास ले रहा शाम को बात करें. कल क्या हुआ? मैं भी जरा लाइव था आराम. Sorry guys, that was my senior. So I'll talk to you in a while. Right. I'll talk to him in a while. Sorry, I'm here. So Mishti said the answer is A and D. That's kind of not the right answer. You're right that A is part of the first extensor compartment, whereas the other option should have been E. Okay, it's A and E. So I'll just show you this a little. Wait a second. Extensor compartment. Just okay. So just have a look at this diagram. You can see here the compartment 1, it has extensor pollicis brevis and abductor pollicis longus. Now, how to remember what goes on in exactly which compartment? So, compartment number 1 and compartment number 3 are very easy. How is that? Because they are basically the boundaries of the anatomical snuff box. They are boundaries of the anatomical snuff box. What was the so this is the if this is the radius, what was the lateral boundary of the anatomical snuff box? It was extensor pollicis brevis accompanied with the abductor pollicis longus. So that is the lateral boundary. And what is the medial boundary? Extensor pollicis longus. So compartment 1 and compartment 3 essentially have the boundaries of the anatomical snuff box. They have the boundaries of the anatomical snuff box. Between them, you have one compartment left. There, what should pass? The radialis muscles, right? What is that? Extensor carpi radialis brevis and extensor carpi radialis longus. Okay, very simple. Now, what is left is radialis brevis and radialis longus have gone. Now extensor carpi ulnaris has to go, so that will go into the last compartment. So compartment number 6 will be extensor carpi ulnaris. Now in between them you have to have the extensors for the digits, right? So that will go from compartment 4. Along with that you will have the extensor for the index finger, that is separate, and then you will have an extensor for digiti minimi going from compartment 5. So that is how you have to get a general idea of how to remember all these compartments and various tendons, various muscles passing through them. All right, that is how you should go about this. So I'll resume this. So first extensor compartment of the wrist will have the following structures: 76 extensor pollicis brevis and abductor pollicis longus, right? These two will be there. So question number 77: muscle supplied by the median nerve. Which is the muscle that is supplied by the median nerve, right? The median nerve, it supplies the muscles of the thenar region, right? So I hope you can answer question number 77. Okay, right. A, B, C, D. So, opponent's pollicis, yes, it is supplied. So, pollicis wale muscles are muscles of the thenar eminence. But you have to remember that adductor pollicis is an exception. It is an exception because it is supplied by the ulnar nerve, not by the median nerve. So, this will not be there. But A, B, C, that those are there, and D is also there because the unipennate lumbricals, they are supplied by the median nerve. They are supplied by the median nerve. So first lumbrical is a unipennate lumbrical, so it is supplied by the median nerve. A, B, C, D. Let's move on. Question number 78. First dorsal interosseous muscle of the hand is supplied by. Very simple question. You should know the nerve supply of interossia. It's very easy. Very easy. The branch of the ulnar nerve. First dorsal interosseous muscle of the hand is supplied by the deep branch of the ulnar nerve, right? So you know that they are supplied by the all introssia are supplied by the deep branch of the ulnar nerve. Okay? All the introssia they are supplied here by the deep branch of the ulnar nerve. So question number 79. Contents of the bicipital groove are. What are the contents of the bicipital groove? So I know I hope you know that bicipital groove present on the humerus, and there are some structures that are running through it. So you should know what are the structures that are running through the bicipital groove. Contents of the bicipital groove. So just tell me one content. I am not sure you'll know the second content, but try to guess at least one of the contents. Okay, right. 79B, absolutely correct. Ascending branch of the anterior circumflex artery. That is one of the contents here, right? So this is the bicipital groove. Here you have the ascending circumflex or anterior circumflex artery, and here you will have the ascending branch. Obviously, posterior circumflex artery is present posteriorly, so there you cannot have an ascending branch which goes into the bicipital groove. Anterior circumflex artery can give an ascending branch which can go in the bicipital groove. Besides that, the synovial membrane of the shoulder, if you've ever drawn that and you've drawn the discontinuity, the synovial membrane of the shoulder, it also extends into the bicipital groove. So 79, option A and B are the correct answers, right? So let's move on to question number 80. The following structures doesn't pass through the carpal tunnel. So you have to tell me the structure that does not pass through the carpal tunnel. Very simple question, 2-second answer, right? Come on, let's see who gives the fastest answer. Okay, Shraddha has given a faster answer. The 80th question, the answer is going to be A, ulnar nerve. Absolutely correct. Ulnar nerve passes superficial to the flexor retinaculum, whereas the median nerve passes through the carpal tunnel. Therefore, in the carpal tunnel syndrome, which is the nerve involved, the median nerve, right? And ulnar nerve passes superficially. Also, these tendons also pass through them. So these are 8 out of the 9 tendons. What is the ninth tendon? Ninth tendon is the tendon for the flexor pollicis longus, and these are all the tendons that pass through the carpal tunnel. 81. All of the following muscles, they will retract the scapula except. So which of the following is not a retractor of the scapula? You have to think about the actions based on their origins and insertions, or if you directly know about the actions. Okay, there is a very simple hint here. Just go into the names of all these muscles and you will understand what is the answer. Jaldi 81 का answer. Doggone no. Doggone no. So both rhomboids, these rhomboids are the major retractors of the scapula. They are major retractors of the scapula. Rhomboids are major retractors of the scapula. You can see because of their positioning, they're very easily able to retract the scapula. बिल्कुल ऐसे horizontally ऐसे लगे होते हैं, retract कर लेते हैं. So B and C, they are not the answers. I have told you this because they are retractors of the scapula. Trapezius also has a few fibers. There are some posterior fibers of trapezius which help to retract the scapula. So answer is not A, the answer is D. You can see the name here is levator scapulae. It is not retractor scapulae, right? although you would say that it is a secondary function, retraction can be a secondary function, but levator scapulae, the function here is elevation of the scapula, right? It is not retraction of the scapula, it is not a retractor of the scapula, right? Question number 81. So question number 82, boundary of the triangle of auscultation is not formed by. So triangle of auscultation, there are a few triangles in the back, uh, essentially. So it's very simple. I'll just show you an image also after this. Question number 82. If you know already the boundaries, you can answer this. Otherwise, I'll have to show you that image to give you an idea. You want me to show you an image first, and then you can answer, or you can take a guess at least. 82A, serratus anterior, absolutely correct answer. Absolutely correct answer. See, this is the boundaries of the triangle of auscultation. You can see here you have the trapezius muscle originating. So these are some horizontal fibers, these are the descending fibers, and these are the ascending fibers, right? And this is the latissimus dorsi climber's muscle, right? So this here, this right here, this empty space is the triangle of auscultation. You can see that the lateral border is formed by the superior lateral border is formed by the scapula. The superior medial border is formed by the trapezius, formed by the lateral border of the trapezius, and the inferior border is formed by the superior border of latissimus dorsi. So there is no role of serratus anterior here. There is no role of serratus anterior here. What are the borders? Here you will have the scapula. Here you have the trapezius, and here you have the latissimus dorsi. Right? These are all the fibers that are going to be there. So serratus anterior does not form part of the boundary. Question number 83. Axillary abscess is safely drained by which approach? So this was your axilla. Right, absolutely correct. 83, the answer is going to be option D, that is floor of the axilla. It is going to be option D, floor of the axilla. So why the answer is option D, floor? Because see, this is the floor of the axilla, and here you don't have any major structures running. If you look at the structure of the axilla, a lot of the structures, they have to they pass along with the roof of the humerus, right? Okay, they pass along the humerus, okay, which is present in the roof. So as you come lower, here you mainly have fat and you have skin. So it is very easy to drain axillary abscesses from the floor of the axilla. That is why answer to question number 83 is option D. Question number 84, which amongst the following is a branch from the trunk of the brachial plexus? Question number 84, which amongst the following is a branch from the trunk of the brachial plexus? Okay, so guys, we'll have to do one thing. Going a little slow, I feel. So we'll make this a little rapid fire. All right, I will read the question, I will read the answer, and I will look for your comments in the comments here, right? So you can keep answering side by side, quickly, and you can keep listening to what I'm telling you. Okay. So which amongst the following is a branch from the trunk of the brachial plexus? Okay. Which amongst the following is a branch from the trunk of the brachial plexus? So you know that there are two branches which come from the trunk of the brachial plexus and two branches which come from the roots of the brachial plexus. So here you will have the two branches are suprascapular nerve and next is the nerve to subclavius. If nerve to subclavius was in the option, it would have been a better answer. It would have been a better answer as I have told you previously. Here question number 84, the answer is going to be A. Question number 85, which tendon is frequently absent in the upper limb? Flexor carpi ulnaris, flexor digitorum profundus, extensor carpi radialis brevis, palmaris longus. The answer is palmaris longus, and you can see that it is absent in some of the people, and otherwise you can appreciate it here. In some people, this is not appreciable, so it is frequently absent because it is a very thin tendon, very is almost towards the extent of degeneration. Question number 86. All of the following are composite muscles except, right? So adductor magnus is a composite muscle, pectineus is a composite muscle, FDP is a composite muscle, FDS is not a composite muscle, so the answer is going to be D. Okay, so the relevant point for the upper limb is that flexor digitorum profundus, its medial half is supplied separately by the ulnar nerve and its lateral half is supplied separately by the median nerve. So flexor digitorum superficialis on the other hand is supplied completely by the median nerve. So it is not a composite muscle. Okay, question number 86. The answer is B. Right? So correct. So here there is a list of all the composite muscles that I put together for you. You can take a screenshot. It is a frequently asked question. So trapezius, you can see is supplied by the spinal accessory nerve. It is the motor supply. And then there is a sensory supply that is for proprioception coming from ventral rami of C3, C4. Digastric, you know that the digastric is supplied differently for the anterior and the posterior belly, trigeminal and facial nerve. Brachialis has a different motor and proprioceptive supply. Motor supply is by musculocutaneous and proprioceptive supply is by radial nerve. FDP, there is a difference between the medial and the lateral half. Flexor pollicis brevis, the deep part is supplied frequently by the deep branch of the ulnar nerve. Opponens pollicis, mainly it is supplied by the median nerve. Sometimes the medial part is supplied by the ulnar nerve. Iliopsoas, you know, is having two different supplies. Pectineus has two different supplies. Pectineus ki nerve supply is important. Femoral supplies the anterior fibers and obturator supplies the posterior fibers. And adductor magnus, this nerve supply is important. The tibial part of sciatic nerve supplies the ischial part and obturator nerve supplies the adductor part. Okay, so ये सब this is from the entire gross anatomy. These are the composite muscles that you can remember. Okay, now question number 87. Cranial part of the accessory nerve supplies. Question number 87. Cranial part of the accessory nerve supplies. Absolutely incorrect, Pooja. See, that is the mistake that a lot of you are going to make. That is why I stopped a little at this question. So it is not the cranial part. It is these two muscles. They are supplied by the spinal part of the accessory. They are supplied by the spinal part of accessory nerve, right? Not by the cranial part of accessory nerve. So A and B both are wrong. Okay. C, levator scapulae, again, it is not supplied by the cranial part of accessory. Cranial part of accessory nerve supplies the pharyngeal muscles through the vagoaccessory complex. Through the vagoaccessory complex. So the answer will be levator palatini. That is a muscle that is supplied by the cranial part of accessory. Not trapezius or sternocleidomastoid. They are supplied by the spinal part of accessory, right? ठीक है, ये मुझे पता था कि ये गलती होने वाली है यहाँ पे. Let's move on to question number 88. Anterior introitious nerve supplies all amongst the following except. So which of the following muscles is not supplied by the anterior introitious nerve? Anterior introitious nerve, it is a branch of which nerve? It is a branch of anterior introitious nerve is a branch of, you know that the medial part, so the medial part and the lateral part are supplied separately, right? The medial part and the lateral part, they are supplied separately. So obviously anterior interosseous nerve cannot be supplying both. It has to be supplying only one. So the answer is between B and C. Alright. That is how you have to use your smart work. Now anterior interosseous nerve, it is a branch of the median nerve. It is a branch of the median nerve. So the lateral half is supplied by the median nerve. So the lateral part of flexor digitorum profundus will be supplied by the median nerve. This will be supplied by the median nerve. So anterior interosseous nerve will be supplying this. Alright. But this is B, the medial part. This is going to be supplied by the ulnar nerve. This is going to be supplied by the ulnar nerve here, right? Let's move on to question number 89. Boundaries of the upper triangular space include all except. Question number 89. Boundaries of the upper triangular space. So the boundaries of the triangular and the quadrangular spaces, I hope you are aware a little bit about them. Right. Subscapularis is not included here. Absolutely correct. So this is kind of a schematic for the boundaries of the upper triangular space and the lower triangular space. So you can see that there are these muscles which form the spaces. Before we move to the actual diagram, let's go to the way of learning this, right? So you keep your fingers like this, like they've shown here, and you will kind of have to make this, right? And that is how you remember the boundaries of which space are what. So the upper triangular space, so you know this finger is teres minor, this finger is teres major. Teres minor is above the teres major. And this is the humerus here, and this is the long head of the triceps, right? So now you can easily form the boundaries. What is the boundaries of this triangular space? Teres minor, teres major, and triceps. Boundaries of the space, triceps, humerus, teres minor, teres major. Boundaries of the space, triceps, right? Triceps here, humerus here, and teres major here. So you can easily form all these boundaries with this diagram here. All you have to remember is that this finger, the index, the middle finger here is the teres minor, the index finger is the teres major. For this hand, this is the triceps and this is the humerus. Alright. So similarly here you can see that in this diagram you get a little better picture that this is the teres major muscle going and this is the teres minor muscle going, right? And here you can see that this is the triceps going here, the lateral head, the long head, and in between them you have the humerus. That is how you can form all these spaces. Then you should know that what structure passes through which space, right? Question number 89, that is about this. Now, what are the structures passing through the various spaces? Upper triangular space, you have the circumflex scapular artery going, right? Quadrangular space, you will have the posterior circumflex humeral artery and the axillary nerve. Triceps hiatus, you will have the profundi brachii artery and the radial nerve. Okay, so that is something that you have to remember here. What is passing? The circumflex scapular artery, right? Circumflex artery. What is passing from here? Pacha and axillary nerve, right? So these are the structures related to the shaft of the humerus. And then you will have here, you will have the profundi brachii artery. So the structures that have to go to the spiral groove, profundi brachii artery and the radius. Or ये circumflex scapular artery, it is coiling here around this. Okay. So question number 90. Froment's sign is seen in. Froment's sign is seen in which palsy? Froment's sign is seen in ulnar nerve palsy. Froment's sign is seen in ulnar nerve palsy, right? That is something you have to understand. That Froment sign, Government sign is ulnar nerve palsy. Right. Question number 91, muscle with dual nerve supply. So dual nerve supply is your again your composite muscles. This is your composite muscle. I just told you about all the composite muscles. You should be able to easily answer this. Question number 91, the answer is brachialis. It has nerve supply from two nerves, musculocutaneous, and it has nerve supply from the radial nerve, which is proprioceptive in nature. Sometimes it is also more. Alright. Question number 92. Following a deep cut overlying the hypothenar eminence, it is observed that the patient cannot hold the sheet of paper between second and third digits. Right? Patient cannot hold a sheet of paper between the second and third digits. Now, why will that happen? Can you tell me? What is required to hold a sheet of paper between the second and third digits? Which action or which muscle will be required? Right. So palmar introsci, right? So your palmar introsci, they will be the ones that will hold a sheet of paper like this between the second and third digits. The palmar introsci are the ones that are involved here in this action, and all the introsci they are supplied by the deep branch of the learner. So the answer is for 92 is going to be A. Okay. Question number 93: which ligament transfers weight from the peripheral to the axial skeleton? Again, this is kind of a very important question that the weight transmission at the shoulder joint, it occurs via the coracoclavicular ligament. It occurs via the coracoclavicular ligament. Right? Question number 93. Question number 94. The term Guyon's canal is in relation to which of the following nerves? I want you to tell me question number 94. It is a pretty straightforward answer. Guyon's canal. Right? There is also it is also called as the pisciohamate tunnel. It is also called as the pisciohamate. Yes, right. The ulnar nerve. So the ulnar nerve palsy can be seen if you have a compression of the Guyon's canal here. So Guyon's canal through which nerve passes? The ulnar nerve. So that is something that you should remember. Question number 95. Nerve related to the anatomical snuff box, which is the nerve related to the anatomical snuff box. So I already told you that you have to remember few structures here. That is the radial artery. You have to remember the superficial branch of the radial nerve. You have to remember the phallic vein. So again here, what are all the structures? That is one artery, one nerve, and one. So here, the nerve that is related is the superficial branch of the radial nerve, right? Question number 95, the answer is going to be option C. Question number 95, the answer is going to be option C. Question number 96, posterior wall of the axilla is not formed by. For this, I will show you the diagram that I showed you yesterday. So the anterior wall is formed by the pectoralis major and the pectoralis minor. The medial border is formed by the thoracic wall and the serratus anterior. Lateral border is formed in the intertubercular sulcus. Posterior border, you will have the scapularis, you will have the teres major, and you will have the latissimus dorsi. You have three muscles. So scapularis, latissimus dorsi, and teres major. So what is left is supraspinatus. So supraspinatus will not form the posterior wall of the axilla. Right? Question number 96. The answer is going to be question number 97. All are contents of the cubital fossa except. All are contents of the cubital fossa except. Absolutely correct. Ulnar nerve is not a content of the cubital fossa. But can you tell me, is it a content of something related to the cubital? Yes, it is a content of the cubital tunnel. It passes through the cubital tunnel between the two heads of the flexor carpi ulnaris. So median nerve, biceps tendon, brachial artery, these are all part of the MBBS. Okay, what is S? S is the superficial branch of the radial nerve. Remember, it is not the radial nerve, it is the superficial branch of the radial nerve, which is a content of the cubital fossa. Okay, please do remember this, that it is not MBBR, it is MBBS. Okay, some colleges, some books, they write MBBR. Okay, that is wrong. Question number 98. Commonly affected nerve in anterior shoulder dislocation. If the shoulder is dislocated anteriorly, what is the nerve that is commonly affected? So you remember along the surgical neck of the humerus, which nerve is related? So that is the axillary nerve. So it will be the nerve that will be affected if you have an anterior shoulder dislocation. Question number 98. The answer is going to be option, the axillary nerve. Right? So, so you know the branches of the posterior cord? The branches of the posterior cord are stars. So here S is the upper subscapular, this S is the lower subscapular, this T is the thoracodorsal, this A is the axillary, and this R is the medial. So what is left here? This is gone, this is gone, this is gone. So the answer is going to be long thoracic nerve. Long thoracic nerve, because it comes directly from the roots of the brachial plane. Comes directly from the question number 100. Superficial branch of the ulnar nerve supplies. Superficial branch of the ulnar nerve supply. You all know the superficial branch of the ulnar nerve. It will supply a single muscle, that is amaris brevis. That will supply a single muscle, that is amaris brevis. Question number 100. The answer is going to be. With that, we are done with the first 100 questions of this MCQ marathon. What are left are around 52 questions, I guess, around 50 questions. Let's move on to question number 101. Carpal tunnel syndrome is caused by a compression. Carpal tunnel syndrome is caused by a compression. Correct? Median nerve. Not not much to tell because it's a very simple explanation. Okay, so I have something to tell you here in question number 102. What is the first primary ossification center to appear for the carpal bones? Okay, try to answer question 102. Let me just switch on my AC. I switched it off earlier. Yes, so question number 102. Okay, right. You're right in saying that the answer is going to be capitate. So see, this is a kind of a sequence which is very easy to remember. If you go this anti-clockwise, if you go anti-clockwise here, you have one center coming approximately at the age of every 1 year. So this is the capitate. It starts from the capitate. That is something that you have to remember. So it goes like 1, 2, 3, 4, 5, 6, 7. Stops at trapezoid. And what is what is the one bone that is left? That is the pisiform bone. What that is the pisiform bone, and that is here in the triquetral, right? And that has its ossification center appearing latest at the 12 years. So this is a good idea to identify the age of a child, right? So if the pisiform bone has ossified, you can make out that the child is 12 years in age, right? If only these three bones have ossified, you can make out. If only the capitate, hamate, and the triquetral have ossified, then you can make out the child is approximately 3 years old, right? So that is kind of an idea. That's kind of a that's kind of a good trick that you can remember. That यहाँ से शुरू करो capitate से और trapezoid पे खत्म करो 7 1 to 7 है और लास्ट में पिसी फॉर्म के लिए 12 लगा देना है ठीक है एंड यू शुड रिमेंबर दिस ऑर्डर क्या होता है वो शी लुक्स टू प्रिटी ट्राई टू कैच हर अटेंशन ठीक है शी लुक्स टू प्रिटी ट्राई टू कैच हर ठीक है तो SLTP ट्राई टू कैच हर so question number 103, which of the following muscles of the thumb is not supplied by the median nerve? Which of the following muscles of the thumb is not supplied by the median nerve? I've stressed this many number of times that which there is one muscle of the thumb of the thenar muscles that is not supplied by the median nerve. Absolutely correct. The answer is going to be adductor pollicis because it is supplied by the ulnar nerve. It is supplied by the ulnar nerve. Question number 104. Pisiform bone articulates with which pisiform bone? The pisiform bone, what does it articulate with? Very easy. I've just shown you an image. Based on that, you can make out that the pisiform bone articulates with which bone? Triquetral, right? Absolutely correct. So just let's come back here, and you can see here that the pisiform bone is clearly articulating with the triquetral bone. You can also make out that it's closest. If you look at the yeah, so you can make out here that the pisiform bone it is articulating here with the triquetral. Question number 105. The first lumbrical canal communicates with what space? Okay. So again, I've not covered the spaces of hand in detail, but you have to know that there are thinars. There's a thinar space. There is a mid palmar space, right? There are these two main spaces. So why this is important is that if there is a kind of a pus in the one of the spaces, can be drained through the lumbrical canals. Okay. So the first lumbrical, I'll tell you, first lumbrical it communicates with the thinnar space, right? It communicates with the thinnar space. So if there is a pus in the thinnar space, it can be drained via the first lumbrical canal. So the answer here is going to be option C. Question number 106. Anterior wall of the axilla is formed by. Anterior wall of the axilla, it is formed by. Yeah, right. Thinnar. Now remember which is the anterior wall. This was the anterior wall. Obviously, which muscles form it? The minor and major. Answer here is going to be pectoralis. Question number 107. In relation to other metacarpals, the first metacarpal is. In relation to other metacarpals, first metacarpal is. Right, so it is medially rotated with respect to the other metacarpals. Okay, so if you look at the thumb, you can see that the thumb is kind of a little. If you just imagine it, you can see that the thumb is a little rotated towards the medial end, like this. You know, it kind of appears that this metacarpal is kind of looking towards the medial side. So this is your hand, this is the medial, this is the lateral side, right? Thumb is the first metacarpal, so it seems to be rotated towards this side. Question number 108. Interosseous membrane between the radius and the ulna is pierced by which structure? Okay, so this is a very question that I had already talked about. Question number 108. The interosseous membrane between the radius and the ulna is pierced by which structure? No, it's not posterior interosseous nerve. So see, I remember telling you that the thing is that if this is the interosseous membrane, this is the posterior interosseous artery. This is the posterior interosseous artery. This is the anterior interosseous artery. This is the anterior interosseous artery. After a point, it crosses here and it also passes posterior to it. Even though it is the anterior interosseous artery, it pierces the membrane at a distal point and it becomes posterior, right? That is why the anterior interosseous artery accompanies the posterior interosseous nerve, right? That is one point that I had to mention. That anterior interosseous artery, it pierces the interosseous membrane between the radius and the ulna. So the answer is D for question number 100. Question number 109. Bursa communicating with the shoulder joint space is, right? So it's easy to answer based on where which bursa is located, and you can guess it on the basis of their names also. That's right. The subscapular bursa is the one that communicates with the shoulder joint space. Question number 110. I've told you in detail about the scapular anastomosis. Please do watch the class on arteries of upper limb on Unacademy. It's a really good class and there's a very quality diagram of the anastomosis of the scapula. Right? Which branch of the subclavian artery do you think contributes to the scapular anastomosis? Very simple to answer. What are the branches of the subclavian artery? So absolutely correct, thyrocervical trunk. So scapular anastomosis is between the first part of the subclavian artery and the third part of the axillary artery. From the first part of the subclavian artery, you have three branches, that is VIT, vertebral, internal thoracic, and thyrocervical trunk. Vertebral, you know, it has no relation here going towards the scapula. It straight away goes up, so it will not contribute. Internal thoracic also runs here. It is also not related in any way towards the scapular side. So only the thyrocervical trunk can take part in the anastomosis. There's a few branches which anastomose with the axillary. Okay. Question number 111. What is the nerve supply of deltoid? Very easy question. Nerve supply of the deltoid. So the nerve supply of the deltoid is the axillary nerve. Nerve supply of the deltoid is via the axillary nerve. Question number 112. Nerve supply of the trapezius is by the nerve supply of the trapezius is by the I don't think so, CP Sharma, because next is an exam for the PG entrance. I'm not sure that I'm pretty sure that they cannot give the next examination. आई डोंट थिंक सीपी शर्मा दे सकते होंगे बिकॉज देखो ना नेक्स्ट एग्जामिनेशन जो है वो पीजी एंट्रेंस के लिए बना है और एमबीबीएस का एग्जिट एग्जाम है सिलेबस सारा एमबीबीएस का होगा तो बैंस वाले आई डोंट थिंक दे सकते हैं क्वेश्चन नंबर 112 nerve supply of trapezius you all know is through option D spinal part of the accessory nerve spinal part of the accessory question number 113 head of the scapula is what is the head of the scapula ये आसान क्वेश्चन है थोड़ा सा रट्टे वाला क्वेश्चन सा है पता होना चाहिए तो आता होगा शर्मा नहीं एमडीएमएस तो पक्का नहीं कर सकते lateral angle. The answer is going to be option C, lateral angle. Question number 114. Root value of the thoracodorsal nerve. Root value of the thoracodorsal. Yeah, so the answer is going to be C. You all know the root values for the thoracodorsal. C6, C7. Question number 115. Ulnar branch collateral nervus. Okay, ulnar branch collateral nervus. Yeah, so remember that the ulnar branch collateral nerve. It accompanies the ulnar nerve for some part. Therefore, it is called the ulnar branch collateral nerve, but it is not a branch of the ulnar nerve. It is a branch of the radial nerve actually. And it is a branch of the radial nerve which supplies the medial head of the triceps. It is the branch of the radial nerve that supplies the medial head of the triceps. So option B is the answer. Question number 116. Largest branch of the brachial plexus. What is the largest branch of the? Okay, so Mishti is saying 116B, median. No, that's wrong. Median is not the largest branch. The median is also helped by the ulnar nerve in supplying the entire anterior compartment, right? The radial nerve, it by itself supplies the entire posterior compartment. So, which will be the largest branch? The radial nerve. Both median and the radial nerve both have root values of the entire brachial plexus, that is C5 to T1. But the radial nerve supplies by itself the most of the extensors and all the brachioradialis. So it has a lot of nerve supply, the radial nerve, right from the arm till the extensor compartment of the forearm also, and all the muscles that have to go for the hand also, the extensors, right? So question number 117, all are infraclavicular branches of the brachial plexus except. I told you the concept of supraclavicular and infraclavicular branches. So the roots and the trunks, they are supraclavicular. Below that you have infraclavicular. So the branches from the cords, they are infraclavicular. The branches from the trunk or branches from the roots, they will be supraclavicular. The long thoracic nerve arises directly from the roots. So it is a supraclavicular branch, like Mishti has written correctly. 117, the answer is going to be option, right? Question number 118. Policeman's tip hand is seen in. Policeman's tip hand is seen in. So you also have to give me the logic, or even if you don't give me the logic, you should understand why the policeman's tip hand kind of configuration is seen in this particular injury. Right. Erb's palsy. Why is this Erb's palsy? Because the root value that is injured is the C5 and C6. Now, if C5 and C6 are injured, that means that the two nerves that you have to pinpoint here should be the axillary and the musculocutaneous. These are the two main nerves that you can pinpoint. Now, if you're pinpointing axillary nerve, it means that the deltoid is damaged. Now remember, the deltoid is responsible for abduction and it is responsible for lateral rotation, right? But if the deltoid is paralyzed, the hand is adducted and rotated, right? It is rotated. And if it is rotated here, and then if you talk about the musculocutaneous, it supplies the flexors, right? It supplies BBC. Although coracobrachialis is expired, but biceps and brachialis, they are mainly affected. So hand is extended. So this arm is extended. This elbow joint is also extended. And the biceps also helps in supination. So supination is damaged, so the hand is pronated. That is something what the policeman's tip hand would look like, right? Question number 119. Pronator teres syndrome is related to which nerve? Pronator teres syndrome. So now you have to think which nerve passes between the two heads of the pronator teres. Pronator teres syndrome is related to which nerve? So there are three muscles that you have to think of. Supinator muscle, pronator teres, and flexor carpi ulnaris. Brachioradialis. Okay. So Vishnu has answered the question. Question number 119 as B. Okay, median nerve. That's correct. So the nerve passing between the supinator muscle that you have to remember is the radial nerve. Nerve passing between the two heads of the pronator teres that you have to remember is the median nerve. The nerve passing between the two heads of the flexor carpi ulnaris. This has the word U in it. That is how you have to remember this. Question number 120. Distal end of the humerus develops from how many centers? Distal end of the humerus develops from how many centers? There are four centers from which it develops. One of the centers, first center is capitulum with the lateral part of the trochlea, right? The second center is for the, if you have a center for the capitulum where you will have the lateral part of the trochlea, you have to have another center for the medial part of the trochlea, right? There is a center for the trochlea, then you have center for essentially for the medial epicondyle, and then you have a center for the lateral epicondyle. Okay, I'm not, so all of these centers they will also give various other structures, but the distal end of the humerus you have to remember develops from these four centers, although not a very important point, especially from a clinical perspective for the next examination. Question number 121. Posterior cord supplies. So, which of the following muscles is supplied by the posterior cord? The answer is for 121. The answer is A, teres minor. Absolutely correct because it is supplied by the Axillary nerve. It is supplied by the axillary nerve. So that's correct. The answer is going to be option A. Axillary nerve is a branch of the posterior cord. You can go either by the mnemonic ulnar, or you can go by the mnemonic lunar, or you can go by the mnemonic star. Right? Question number 122. Which of the following movement of the thumb is lost in ulnar nerve injury? Which of the following movement of the thumb is lost in ulnar nerve injury? Do you know that there is a specific muscle of the thumb is being supplied by the ulnar nerve? That muscle is the adductor pollicis, and as the name indicates, what is its function? Adduction. Adductor pollicis gets damaged, adduction of the thumb will be adduction, adduction. 122, the answer is going to be question number 123. Coracobrachialis is pierced by which nerve? Which nerve pierces coracobrachialis? Answer is musculocutaneous. Yes, that is how you identify the musculocutaneous nerve. That first thing that you have to identify about the musculocutaneous nerve is this M-shaped structure that is seen when you look closely at the cords, right? And then second thing is that it pierces a muscle, and that muscle it pierces is the coracobrachialis. So you can either use it to identify the nerve, or you can identify to, and you can use it to identify the muscle also. That if there is a muscle there that is being pierced by the musculocutaneous nerve, that will be the coracobrachialis muscle, right? Question number 123. Question number 124. Radial bursa is the synovial sheath covering the tendon of. Radial bursa is the synovial sheath covering the tendon of. Is the synovial sheath covering the tendon of? Option C, flexor pollicis longus. That's correct. Flexor pollicis. Question number 125. Which muscle will be paralyzed when radial nerve is injured in just below the spiral groove? Just below the spiral groove, which muscle will be paralyzed? Very easy question. Okay, we've discussed the radial nerve, its course, its lie in detail in the class on the nerves of the upper limb, which I would again recommend that you guys go and definitely watch. A long class. You can skip through the MCQs. You can watch it on 1.5x, and you will be able to understand everything. right? So there are two muscles. So if you look at this, this is the spiral groove, this is the axilla, and here it continues. The radial nerve continues. So before it goes to the lateral epicondyle, it gives two branches, one to the extensor carpi radialis longus and one to the brachioradialis, right? Before the lateral epicondyle, before it passes over the lateral epicondyle, right? Here, if the injury is here, so this is the radial groove, this was the radial groove, the injury is just below the spiral groove, right? So this is the point of injury. Okay. And if this is injured, obviously the nerve supply to extensor carpi radialis longus is gone. The answer for question number 125 will be option extensor carpi radialis. Okay. Question number 126, which muscle does not take part in the dorsal digital expansion? Muscle does not take part in the dorsal digital expansion. Remember, it has to be a muscle which can take part in the dorsal digital expansion. Does not take part. Guys, I hope I've told you enough about my plus referral code Chetanya 10 and what are the advantages of using it. If you're not sure, you can text me on Instagram at the rate Chetanya.blue. Chetanya.blue is my Instagram handle. And you can also join my Telegram channel. That is, type NEET PG Chetanya on Telegram in the global search and you will find my channel. You can also find the discussion group there. And in the discussion group, you can ask about the plus subscription and I will get back to you. So is anybody telling me the answer for question number 126? The answer here is adductor pollicis. Adductor pollicis, you all know, is an adductor of the thumb. It has no role to play in the dorsal digital expansion. Dorsal digital expansion, you also called as the extensor hood. You will have the interossea, you will have the lumbricals, you will have the extensor digitorum attaching, but you have no role of the adductor pollicis. Question number 127. In forearm, the ulnar nerve gives a muscular branch to which muscle? The forearm, the ulnar nerve, it will give a muscular branch to which muscle? Looking for an answer from your end, guys. See, there was a similar question which said in the arm, the ulnar nerve gives muscular branches to which muscle? So you have to remember that in the arm, the ulnar nerve, it does not give any branches. Ulnar nerve, it does not give any branches, right? That's the first thing that you have to do. The forearm, the ulnar nerve does give muscular branches, and the muscular branches that it gives are first towards the medial half of the flexor digitorum profundus, and since it passes between the two heads of the flexor carpi and laris will also supply the flexor carpi and laris. So the answer is going to be option C, both. Right? Be very careful whether it is written forearm or it is written arm. Okay, that is one point of error that you can be making. Now moving on to question number 128, which muscle causes retraction of the scapula? We've already discussed this. What are the retractors of the scapula? So can you tell me the answer for question number 128? Retraction of the scapula, the major retractors of the scapula, as you know, are the rhomboids, right? The rhomboid major and the rhomboid minor. The rhomboidus major is obviously the major retractor here of the scapula. Then levator scapulae, as you know, is an elevator of the scapula. And in the retractors of the scapula, you will have mainly the rhomboids, and some fibers of the trapezius can also retract the scapula. There are some fibers of the trapezius also play a role in retracting the scapula, especially ones which have similar orientations as the ones of the right. So question number 129. All are true regarding axillary lymph nodes except which statement is incorrect about axillary lymph nodes, right? So this is usually studied the lymph supply of the breast or the lymphatic drainage of the breast, lymphatic drainage of the axilla even, axillary group of lymph nodes. So there are right. So take a guess even if you don't know how to answer it. Take a guess. So I don't think anybody knows the answer to these questions. So yeah, this is a little difficult one. The lateral group, it lies along the upper part of the humerus in the relation to the axillary vein, not with the lateral thoracic vessels. Okay, this is wrong because this has to be axillary, and this should have been axillary vein on the lateral part of the humerus. The answer is option B. Answer for 129 is option B. Question number 130. All are true about the mammary gland except. All are true about the mammary gland except. There is one statement that is false here about the mammary gland. The incorrect one is option B. Nipple is supplied by the 6th to 11th intercostal nerve. No, it is supplied by the 2nd to the 6th intercostal nerve. Yes, they are correct. Mammary gland is a modified sweat gland which extends from second rib, second rib to the sixth rib vertically, and it is supplied by the internal mammary, the internal thoracic artery. Has a multiple arterial supply. One of the arterial supplies is the internal thoracic artery. Question number 131. All are contents of the axilla except. All are contents of the axilla except. It's simple. Again, apply the concept of supraclavicular and infraclavicular in the brachial plexus, and you will come to your answer. So yeah, roots of the brachial plexus. The answer C. Axilla is obviously an infraclavicular part, right? Axilla is obviously very inferior to the clavicle, whereas the roots of the brachial plexus, along with the trunks, they are supraclavicular parts. Roots and trunks, they are supraclavicular parts of the brachial plexus, so they cannot be a content of the axilla. Inferior cords and everything, they can be passing. The brachial plexus does pass through the axilla, but the roots of the brachial plexus, they are supraclavicular to be passing through the axilla. So that is for 131. The answer is D. Yes, Mishti has also given the correct answer now for question number 131. Let's move on to question number 132. Boundaries of the anatomical stuff box are all except. What are the boundaries of the anatomical stuff box? So if this is your hand, right? It's going to be the lateral side. This is going to be the stuff box is somewhat here, right? But I'll kind of sketch it out here. So here there is a going to be a first of all there is going to be a tendon, that is the abductor pollicis longus, and inside there is going to be a tendon for extensor brevis, right? Extensor pollicis brevis, right? That is going to form the lateral boundary. I'll just sketch it in a better way. 132, the answer is D. That's true. Extensor carpi ulnaris is not in any way a boundary. What you should be doing is you just draw the extensor pollicis brevis and draw the extensor pollicis longus. Along with that, give this the adductor, give this the abductor pollicis longus. Sorry, the abductor pollicis, and that is how you will get the anatomical snuff box. The lateral boundary, this is the medial boundary, and that is all you need. This is all cancelled. The answer is going to be option. Question number 133. Which of the following nerve carries fibers from all the roots of the brachial plexus? So I've told you this multiple times. Which are the two nerves that carry fibers from all the roots of the brachial plexus? Right. So Mishti has given the correct answer. That is the median nerve. So even the radial and the medial, these two nerves, radian, radial and the median nerve, both of them have root values 5, C6, 7, 8, and T1. That is all the roots of the right. That is for question number 130. Question number 134. Branches of the brachial artery are all except. So again, this was discussed in the arteries of the upper limb. Discuss this in the arteries of the upper limb on how these various arteries are branching out. Right. The answer is going to be radial collateral. Why? Because it is a branch of the profunda brachiae artery. Radial collateral artery is a branch of the profunda brachiae. The answer is going to be option. Question number 135. Which muscle originates from the tendons of the other muscle? Muscle, it is originating itself from the tendons of another muscle. That is your question. Right. So Mishti has given the answer as palmaris longus. That is incorrect. 135. The answer is not going to be palmaris longus. I was waiting for some recorrection in that answer. The answer is lumbricals. Because lumbricals, they take origin from the tendons of the flexor digitorum fundus. Lumbricals are the muscles that originate from a tendon. They originate from the tendons of the flexor digitorum fundus. And that is why the answer is going to be option C, not option A. Question number 136. Flexion of the MCP joint is produced by which muscle produces flexion of the MCP joint? All right. How to learn origin and insertion of each muscle? See, it's kind of if you know the action, you can think about the origin and the insertion. There's no need to be very specific about each origin and insertion. You don't need to remember the exact regions, right? But you can have an idea that this muscle will originate from kind of this region, and that is what will be present in this region, right? That is kind of how you have to go about it. As then, if you have a look at the atlas images, if you have a look at the atlas images, for example, the Netter's atlas, that will give you a good idea of how the muscle is taking its origin, where it is inserting, and that will create a visual image in your head. कि चलो यहाँ से आ रही थी, इस bone से आ रही थी इधर को, and bone में जाके लग रही थी. या फिर इस muscle का origin किसी और muscle में हो रहा था, या किसी और tendon में हो रहा था, या किसी और ligament में हो रहा था. ऐसा कुछ होगा वो, you will get an idea. Okay, so now for now, answer question number 136. Yeah, you're right, lumbricals, but even dorsal interosseous and palmar interosseous, all of these muscles, they are responsible for flexion at the MCP joint and extension at the interphalangeal joint. Extension at the interphalangeal joint. All of these muscles, they have the same role. 130. Question number 137. A person had injury to the right upper limb. He is not able to extend his fingers, but he is able to extend his wrist and elbow, which is the nerve that is injured. The nerve that is injured. And I'll tell you one thing, the origins and the insertions per se, they are not very important also. It is much more important for you to know the nerve supplies, for you to know which muscle is oriented where, rather than knowing कि exactly कहाँ से origin करके कहाँ insert हो. That is more important to understand the actions. ठीक है, अगर if you can understand the actions without knowing the exact original insertion, that is good enough. Question number 137. Question number 137. The answer is going to be posterior introtius. ठीक है. See, he had an injury to the right upper limb and he is not able to extend his fingers. So his fingers are dropped. They are not extended. They are dropped. But he is able to extend the wrist and he is able to extend the elbow. That means that he does not have wrist drop. Alright. His triceps are working okay. But he has finger drop. He has finger drop. So the lesion can be in the posterior introtius nerve, because the posterior introtius nerve, it comes after the wrist extensors have been supplied, after the triceps has been supplied, but the extensor digitorum is still supplied by the posterior introtius. So if there is an injury to the posterior introtius, there will be finger drop without wrist drop and sparing of extension of the triceps, right? Question number 138. Which of the following is not the muscles of the superficial anterior compartment of the forearm? Which of the following is not a muscle of the superficial anterior compartment of the forearm? Right. So 137 you said is B. Wrong. It is a posterior introtius nerve injury. You're saying 138B. Right. So flexor pollicis longus is a muscle of the deep anterior compartment. Absolutely right. It is a muscle of the deep anterior compartment of the forearm. It will be supplied by which nerve? It will be supplied by the anterior introtius nerve. Am I right? It will be supplied by the anterior introtius nerve, because the muscles which are deep, which are in the deep compartment, that is like the flexor pollicis longus or the pronator quadratus, they are supplied by the anterior introtius nerve. Alright, question number 138, the answer is going to be B, that's correct. Question number 139, nerve supplied to the muscles of the flexor compartment of the arm. Very easy question. Uh, Nerve supplied to the muscles of the flexor compartment will be the Leber's nerve, because the forearm, the flexor compartment of the forearm of the, oh wait, there's a slight catch here. I just forget what I just told you. I just read the question more carefully right now. No, that's wrong. That's wrong. That's wrong. That's not. That's not the correct answer. See, it is saying nerve supplied to the muscles of the flexor compartment of the arm. Right? Nerve supplied to the flexor compartment of the arm. Right? Here the question says nerve supply to the muscles of the flexor compartment of the arm. Why it is not the median nerve? Because median nerve supplies the flexor compartment of the forearm. Okay, it is again the issue between arm and forearm. Right? Sometimes we use them interchangeably in daily language, but when you talk specifically with respect to anatomy, these are distinct terms. Median nerve supplies the flexor compartment of the forearm. That is why it is called the Leber's nerve. Flexor compartment of the arm has your muscles BBC, biceps, talus, and coracobrachialis, and they are all three are supplied by the musculocutaneous nerve. All three are supplied by the musculocutaneous nerve. The brachialis is the main flexor here, right? So musculocutaneous nerve. Option C. 139. The option is going to be C. Question number 140. Flexor digitorum profundus muscle nerve supply. What is the nerve supply of the flexor digitorum profundus? We already talked this, to the medial half is supplied by the ulnar, the lateral half is supplied by the median. So now you can easily choose your answer. Medial half by the ulnar, that's option. Question number 140, the answer is going to be option. Question number 141, dynamic stabilizer of the shoulder joint. You know that this term is directly used. Term dynamic stabilizer of the shoulder joint is used straight here. You know the stabilization of this joint. It is done by four muscles here. What are the four muscles? SITS. SIT, these muscles insert on the greater tubercular. This inserts on the lesser tubercular. Supraspinatus, infraspinatus, teres, right? And this S here is going to be teres minor, right? S here is going to be subscapularis. All of these are muscles of the rotator cuff, and they are known as the dynamic stabilizers of the, right? Question number 141. Question number 142. Dermatome in the thumb region is supplied by. Okay, I want your answers on this. Which is the dermatome in the thumb region? Dermatome of the thumb region. Take a guess here for the dermatome of the thumb region, please. P8, no, that's wrong. I'll show you the dermatomes here. So look at these dermatomes. First thing that you should know is that this is C5. After C5, you have T1 here, right? After C5, you have T1 here. So this is the C5, and then the C6 goes here and it extends into the thumb, right? T7, C8 are here, and then you have T1, which is extending like this, right? So the dermatome of the thumb, you can see this is the thumb. The thumb is being supplied by the C6 dermatome. Thumb is being supplied by the C6 dermatome, right? For 142, the answer is going to be option B. 42, the answer is going to be option. Dermatome of the thumb region is supplied by. Now let's move a little faster. The patient woke up from sleep with a difficulty in extending the fingers. Right? He is not able to extend the fingers. He can make a grip and hold the pen, so that means his long flexors are intact. Wrist extension is also possible, and he has no sensory disturbance. Injury could be at which level? This is again a similar case. We have seen a similar question before, right? That the patient has the only difficulties in extending the fingers. This means that the patient has finger drop. The patient has finger drop. It is obviously a injury of the related to a radial nerve or the branch of a radial nerve. He can make a grip, so it means that the flexors are intact. So it means that it is not a median nerve injury. Wrist extension is also possible. So it rules out injuries that are proximal in the that are higher level injuries of the radial nerve, and there has been no sensory disturbance. The injury has to be very distal, right? So at which area could the injury be at? At the posterior interosseous nerve. Why? Because it will not have any sensory disturbance because it is a motor nerve, and that will lead to finger drop without wrist drop or flexed elbow, right? Question number 144. Pisiform is which type of a bone? Very simple question. 12th level question. Pisiform is which type of a bone? Pisiform, as you all know, जल्दी जल्दी आंसर बता दो इसका तो pisiform bone is a sigmoid bone, right? Pisiform bone is a sigmoid bone. Question number 145. Anastomosis around the shoulder is for the connection of. I have again specified this. I have stressed on this a lot of time that scapular anastomosis, it is formed between which parts of what arteries, right? So as you can see in all the options, it is between the subclavian artery and the axillary artery. Hisbanaz is right. Option B, 144. Correct. This is word bone. Now, what about 145? I've given you a logic also why it should be which part with which part. If you are forming an anastomosis, say, let's say for example you are God, then think about this question. कौन ही भगवान है का लॉजिक लगाओ और फिर इस क्वेश्चन के बारे में सोचो. True, first part of subclavian artery with the third part of the axillary artery. Just think of it in this way. Axillary artery is a continuation of the subclavian artery, right? This is first part subclavian artery, second part of subclavian artery, and third part of subclavian artery. And this is first part of axillary artery, second part of axillary artery, and third part of axillary artery. Now, if I had to make an anastomosis, so I will try to make it between the most distant things, right? If I make an anastomosis here, there is almost no point, because if there is there is some damage here, this anastomosis will not be able to sufficiently compensate. So the more effective anastomosis will be the more distant anastomosis, right? So I will make an anastomosis between the first part of the subclavian artery with the third part of the axillary artery, right? Question number 146. Carpometacarpal joint of the thumb is. Obviously, carpometacarpal joint of the thumb is a saddle joint. It is obviously a saddle joint. We all know this. Question number 146. Answer is going to be option A. Question 147. Power grip of the hand is due to. Power grip of the hand is due to. I just told you right now that the power grip or the grip that your hand makes, that is due to which muscle? That grip is mainly contributed. Grip is mainly contributed by the long flexors of the hand. Grip is mainly contributed by the long flexors of the power grip. Question number 148. Which of the following arises from the infraglenoid tubercle? Which of the following arises from the infraglenoid tubercle? So there is the long head. So there are two long heads, right? This is the supraglenoid tubercle. This is the infraglenoid tubercle, right? So both the long heads take origin from one each. So each of the long heads takes origin from one of the tubercles, right? Biceps ka bhi or triceps ka bhi. So tell me which one will be more superior, the long head of the biceps or the long head of the triceps? एक लॉन्ग हेड ऑफ बाइसेप्स यहाँ से भी ओरिजिन ले सकता है या यहाँ से भी ओरिजिन ले सकता है, ट्राइसेप्स यहाँ से ओरिजिन ले सकता है या यहाँ से ओरिजिन ले सकता है, कौन कहाँ से ओरिजिन लेगा? 148, the answer is option B, long head of the triceps. So first thing, these tubercles over the glenoid cavity, they give origin to the around the glenoid cavity, they give origin to the long heads. ठीक है? So biceps is a anterior, it is a more superior muscle. So long head of the biceps comes from the supraglenoid tubercle. The long head of the triceps comes from the glenoid. Question 149. Carpal tunnel contains all except. Carpal tunnel contains all except. So you know that there are carpal tunnel has one nerve plus 9 tendons. One nerve plus 9 tendons. What are those 9 tendons? The one nerve is the median nerve, you all are aware, and those 9 tendons are flexor digitorum superficialis 4, flexor digitorum profundus 4, flexor pollicis longus 1. These are 9 tendons, right? And so flexor carpal naris, it does not pass through the carpal tunnel. Question number 150. Muscles in the extensor compartment which cause flexion of the elbow. Muscles in extension compartment of the forearm which cause flexion of the elbow, right? So this is a very exceptional muscle because it is supplied by the radial nerve. It is supplied by the radial nerve even though it causes flexion. Okay, it is an exceptional muscle because it is in the extensor compartment of the forearm, but it still causes flexion of the elbow. It is a muscle in the extensor compartment, but it causes flexion of the elbow. The answer is very simple. The answer is going to be brachioradialis. Brachioradialis. Brachio means it takes आजा आजा। ठीक है, brachioradialis breaks rule. Okay, then question number 151, division of the radial nerve occurs at which level? It occurs in the interior part of the lateral epicondyle. Interior part of the lateral epicondyle. We had discussed this question yesterday. Last question is question number 152. What is the total number of dorsal introtia? What is the total number of dorsal introtia? You all know that there are how many introtia in the hand? 8 introtia in the hand, 4 dorsal and 4 common introtia. Right? Answer for 152 is going to be C. It is different for the lower limb, right? It's different for the lower limb. Lower limb you have 4 plus. That's about today's class. Hit the bell icon for notifications. Subscribe to Unacademy's YouTube channel, that is Let's Crack NEET PG. Use my referral code Chetanya10 to get a 10% discount. You will also get a cashback from my end, and you can also be using credits. The Telegram channel is at the rate NEET PG Chetanya, and my Instagram handle is at the rate Chetanya.you. You can contact me here for any doubts. रुक जा यार, 1 मिनट रुक जा. That is the end of this class. You can log off. I'll just be ending the stream. I'll just be ending the stream. This will